This is Dr. Caroline Peterson and Natural Women's Health Institute in Sarasota, Florida. Today, I'm talking to you about the glymphatic system. The glymphatic system was named only in 2012, so it's something that's recently sort of come into our awareness. Of course, it's always been there, but we haven't really thought of it the way that we think of it now. It's basically the brain's lymphatic system. So it's exclusively, the lymphatic system is exclusively in the brain. And it's actually primarily made out of cerebral spinal fluid. It's for transporting the cerebral spinal fluid in that subarachnoid space, and then blending with the interstitial fluid in the brain, and then following the arteries and veins out of the brain pretty much into the regular lymphatic system. So these pictures we're going to take a step back now and we're going to kind of go through things piece by piece. So these pictures show us the cerebral spinal fluid. That is kind of like the water that's in the bag that holds the brain and the spinal cord, which together are called the central nervous system. So you can see the blue stuff is the cerebral spinal fluid, and it goes all around that central nervous system, protecting it. So that's a component of the glymphatic system. The cerebral spinal fluid has been identified and talked about it for much longer than the glymphatic system. Of course, people noticed that if they got hit in the head, if there was a crack in the skull, then water would leak out. And so they knew something was going on. They didn't know what it was, but they did see that there was water in there. At first, they thought it was a kind of blood that was inside of the nerves that leaked out if there was a skull injury. And later they did call it lymph. And then finally, in the 1700s, people started to kind of understand the system better. Of course, it goes away, after you die. And so people could see like the ventricles and stuff like that were still there in the brain, but the cerebral spinal fluid took longer to kind of identify and understand. And of course, because everybody was pretty much working in isolation and there was a problem with language and publication, of course, sharing information wasn't really happening. And so what you really had was a number of different people coming to the same conclusions around the same time. So again, coming back to the glymphatic system, which is the system that the cerebral spinal fluid moves in when it's actually involved in cleaning the brain, along with combining with the interstitial fluid. So the glymphatic system kind of is its own fluid, because it's a combination of the cerebral spinal fluid and the interstitial fluid. But what's really more special about it is the way that it moves, how it moves. That's the thing that's really special about it. So the parenchyma here is really what we think of as the brain. It's the white and the gray matter. And so the parenchyma has interstitial fluid, and an interstitial fluid is just extracellular fluid. And so, so when the cerebral spinal fluid part of the glymphatic system washes into the parenchyma and joins the interstitial fluid, that's when it's doing its like washing of the brain. The parenchyma, so we know it's really kind of the brain. The brain is made out of neurons and glial cells. And so the glial cell that we're really interested in for the glymphatic system is this astrocyte, the one on the bottom right. And that's the one that kind of looks like an octopus. And it's holding on here to a blood vessel. And that's what astrocytes do. They hold on to blood vessels with their little feet. So we know that cerebral spinal fluid is made out of water and sugar, protein, lipids, and electrolytes. Interstitial fluid pretty much has the same thing in it. It has also salts, acids, hormones, neurotransmitters, and cellular waste. So the interstitial fluid has that combination of cerebral spinal fluid, interstitial fluid, plus some immune components. The glymphatic system is called the lymphatic system of the brain because it has those immune components in it and pretty much similar constituents as the lymph fluid, which is made out of interstitial fluid, lymphocytes, bacteria, cellular debris, plasma proteins, and other cells. So when you think about the glymphatic system, the main thing is that this is a mechanism by which waste is eliminated from the brain, the immune system is supported in the brain, and nutrition is transported in the brain. That's the glymphatic system. So the way that it works is that it's a low pressure system and it travels around the cerebral arteries and veins. So it doesn't really travel inside of anything, it travels around the arteries and the veins. And it's the little feet of the astrocytes, the glial cells, that help it to move. And that's done also with the help of these aquaporins. So in this picture, you see the vessel, you see the astrocyte and their little feet. And this is a close-up of their feet. So inside of their feet, they have the aquaporins, which are water channels. And it's the aquaporin 4. There's different kinds of aquaporins, but the ones that are used with the astrocytes and with the glymphatic system are the aquaporins 4. So the astrocytes are around almost all of the capillaries in the brain. They're very, very extensive. So that means your brain gets a good wash. And the aquaporins were discovered a little bit before, 20 years before the glymphatic system. And they're helpful for fluid homeostasis, balancing the fluid. They're also, in other cases, can be related to exocrine fluid secretions like sweat, tears, saliva, digestive enzymes, bile, and milk, and hydrating the epidermis, helping cell migration, neural excitation, proliferation of cells, and fat cell metabolism. So they can have a lot of different jobs, but the one we're looking at in the brain is really as a water channel that is helping with fluid homeostasis. So this is a close-up of the picture that we saw before, the astrocyte and the little feet. And then inside of the little feet, we have the aquaporin that are helping to regulate fluid dynamics. We see in this perivascular space around the vasculature, so red is artery, that we have blue is water, yellow is solutes. So those are the cells and things like that. The debris or the neurotransmitters or the tau or the beta amyloid plaques or what have you, whatever it is, the nutrition, the lipids, that's the yellow. So they're going around in that perivascular space as part of the glymphatic system. Movement in the glymphatic system is caused by the cerebral arterial pulse, which of course is caused by the heart. And there are also macrophages, which are part of the immune system and that live on the border of the brain. and they help to regulate cerebral spinal fluid flow um, between the extracellular matrix, which is the interstitial fluid area. And then that influences how stiff the arteries are and what the pulsations are. Um, and so the macrophages, or the immune system, is a component that is related to how the glymphatics move. So that if there is infection and inflammation, then you're probably going to have more stiffness and tighter pulsations, smaller pulsations, so poorer movement. Glymphatic movement is also regulated and stimulated by the vagus nerve. And so the vagus nerve is one of the big parasympathetic nerves in the body, the biggest. And so when we're in parasympathetic dominance, that's when things in the glymphatic system move best. And we should generally always be in a state of parasympathetic dominance. So we have the arterial pulse, the movement of the vasculature, and breath. These all determine the direction of flow. So that we have the cerebral spinal fluid moving in the subarachnoid space into the periarterial space, then mixing with the interstitial fluid, and then moving out of the parenchyma into the perivenous spaces, and then draining into the peripheral lymphatic system, or recirculating back up into the brain to do another round. So glymphatics begin and are produced, cerebral spinal fluid is produced, glymphatics are produced in the choroid plexus. So we have that in the ventricles. So the lateral ventricle has a choroid plexus in the brain. The third ventricle and the fourth ventricle all have choroid plexuses that are producing cerebral spinal fluid. And so this is where the glymphatics begin. Then this is a slice into your head. And this is the bone on the top piece here on the left. And then the meninges, the bag that holds the central nervous system that we were talking about, is made out of 3 levels: the dura, the arachnoid, and the pia mater. And so the subarachnoid space, that is the one that goes between the arachnoid mater and the pia mater. That's where the cerebral spinal fluid is moving as it relates to glymphatics. So here on the right, we have the yellow, the subarachnoid space, the ventricles. So these are the places that the glymphatic fluid is moving, the cerebral spinal fluid is moving. So the cerebral spinal fluid follows the arteries into the brain. So here's the arteries. Cerebral spinal fluid follows the arteries into the brain so it can mix with the interstitial fluid in the brain, washing the brain. And then once it's done its wash, then it follows the venous system out. So this is a venous system. So typically in most parts of the bodies, the arteries and veins travel together. But in the brain, it's not like that. The veins and the arteries have very different distribution. And so both of them are important. And so you get a very comprehensive sort of wash of the brain when you're using different veins and arteries to move in that perivascular space with the glymphatic system. So when they're done with the wash, they're following the veins out. The glymphatic system either moves the fluid down into the lymphatic circulation in the neck, and then down into the chest, or it can recycle, and it can move up back into the brain via this pontine cistern right here in front of the area just below the pons in the brainstem, and then continue up the basilar artery in the front of the pons, and then move into the circle of Willis, which then will separate out into the anterior, middle, and posterior cerebral arteries. And then we begin the work again. So we talked before about the glymphatic system washing the brain. So it's good for waste clearance. So we know right now that neurodegenerative diseases do not have a glymphatic system that is functioning as well as it could or should. And so then that could be one of the reasons for the accumulation of the beta amyloid plaques, the tau tangles, and things like that, the debris in the brain that's related to neurodegenerative conditions. The glymphatic system also is related to transporting fuel and nutrition like glucose, lipids, amino acids, neurotransmitters, antigens, and immune cells. So transporting nutrients and also components of the immune system. And it's also an information system. And so it's an information system for the immune system. So it picks up information in the brain, carries it out, brings back up helpers. And so it has a lot of regulatory jobs that it's doing. So lipid transport by the glymphatics is very important. The brain contains 25% of the body's cholesterol, but only 2% of the body's weight. And the brain synthesizes all its own cholesterol de novo itself from scratch. The ApoE and the ApoJ are the transporters that transport cholesterol to neurons in the brain. So everybody knows about the ApoE. The ApoE4 is a variant that's related to late onset Alzheimer's. And so what happens with that one is that the transport is not super awesome. And that increases the risk of late onset Alzheimer's. The ApoE lipoprotein is produced by the astrocytes too, and by the choroid plexus. So lipid transport is important by the glymphatics, and is also a lot of shared localities with the glymphatics because of the shared astrocyte and choroid plexus importance. So the glymphatic system and the lymphatic system both are important for tissue homeostasis, interstitial fluid movement, immune function, and waste clearance. So you can see why they call the glymphatic system the lymphatic system of the brain. The glymphatic system works primarily while we sleep. It's 90% more active when we sleep. And it's most active in non-REM, rapid eye movement, sleep. It seems like, well, what we understand now is that the system is turned up by norepinephrine. Part of the reason that the glymphatic system is more active while we sleep is that the glial cells shrink so that there's more perfusion of the cerebral spinal fluid into the parenchyma, and that will help with that washing of the brain. Another reason is because when we sleep, we're generally laying on our back or on our side, and that's when the glymphatic system gets its best movement. And so those could all be kind of contributing factors for why the glymphatic system seems to be more active while we sleep. So the stages of sleep are the N1 non-REM stage 1. That's when you're falling asleep. It's just a few minutes. And then the non-REM stage 2 is a light sleep, and that's around 25 minutes. And then the one really where we're getting a lot of glymphatic activity is the N3, the non-REM stage N3. And that's when the body is remodeling, remaking, renewing. And that's when the glymphatic system is most active, and that takes around 30 minutes. And then the final stage is the REM sleep, and that's about 10 minutes. So 75% of sleep is non-REM. We go through 4 to 5 sleep cycles each night, and each cycle lasts around 90 minutes or so, a little over an hour and a half, under 2 hours. And N3 is the one that we're really thinking is most active for the glymphatic system. And that's the one that happens around every 90 minutes. We know that norepinephrine peaks around the time of sunset, more or less, and then it declines precipitously before midnight, and it's lowest between midnight and 7 a.m. So one of the things that could be influencing the glymphatic system, just because of that timing, is the retinal hypothalamic tract. And so this tract is inhibited by light and stimulated by darkness. So when we perceive darkness, that activates the tract in the retina, and then it's going up into the brain where norepinephrine is stimulated. And then that is going to stimulate melatonin, and that will help with sleep and many other things. But it's thought that perhaps this is in part playing a role with regulation of the glymphatic system and its primary activation at night. So here we have norepinephrine that is low in the day, and then it comes up again around sunset, and then goes lower in the night, and then comes up in the late in the early morning. You can see melatonin here. It has a little bit of lag on norepinephrine, since the norepinephrine needs to be is one of the things that probably is related to needing to be secreted before the melatonin kind of takes off. So some have postulated that perhaps the real purpose of sleep is to establish a state for the glymphatic system to efficiently clear the cerebral central nervous system of metabolic waste. So maybe the glymphatic system is really what sleep is all about. What we know is that the glymphatic system decreases in function as we age typically, and that it's also impaired by other neurodegenerative conditions, such as Alzheimer's and Parkinson's, but not even that only. I mean, it can be, in my clinical experience, it can be traumatic brain injuries. It can be inflammation of the brain caused by viruses or by sugar. It doesn't even have to be diabetes. It can be, pre-diabetes or just dysregulated blood sugar. It can be, a leaky blood-brain barrier that allows for infiltration of heavy metals or mycotoxins or by other biotoxins, or all of these things can make the glymphatic system kind of heavy and slow. And all of those kinds of incursions into the brain can be supported with glymphatic drainage. So we know the things that impairs astrocyte function are also pretty much the things that impair glymphatic function. So we're talking about neurodegenerative diseases, we're talking about stroke, traumatic brain injury, and when the liver backs up, then those toxins are going to overflow into the brain. These things cause the astrocytes to swell. And then we're going to have mislocalization of those aquaporine. And so instead of those water channels being on the feet where they're supposed to be so that they can regulate the fluid in the brain, they move up into the body of the astrocyte where they become much less effective. And so then that could be part of the reason where there's impairment of the glymphatic system. And I know this is just a hypothesis, but I definitely see it in my practice with the patients that I treat. So problems with the heart are going to decrease lymphatic function because because the heartbeat is part of what moves the glymphatic system. If you have low blood pressure or high blood pressure, you're also going to have problems with glymphatic movement. If you're sympathetic dominance, you're not going to be getting that parasympathetic input, that vagus input to the glymphatic system to move. Where's my bottom one? I don't know how to get this bottom thing to show. But I think the bottom two, whatever they are, I don't know how to get that to leave. Oh, there goes. Meningeal lymphatic drainage. So if there's a problem with the meninges, so let's say if there's a problem, it could be a torsional problem of the meninges, for instance. That's what craniosacral therapy works with. That would impair lymphatic drainage. And then we talked about the mislocalization of the aquaporins. If you do have that swollen and injured astrocyte, that would be caused by stroke, neurodegenerative conditions, any kind of inflammation in the brain, and so forth. If you have an impairment of the cerebral blood flow, it doesn't have to be a full-on stroke. It doesn't have to be a full-on clot, but anything, if there's thick blood, if there's congestion, if things are not moving properly, then that's going to impair glymphatic function. And then if you're not a good sleeper, if you have sleep disturbances, if you work the night shift, if you're waking up multiple times at night, if you're going to bed too late, any of those things are all going to impair the glymphatic system. And the impaired glymphatic system leads to waste accumulation in the brain, neural inflammation, and then neurodegeneration. This may not be a full-on neurodegenerative condition. It could just be cognitive decline, which is a major thing. Even not remembering a word, where did you leave your keys? Where'd you park the car? Why are you in this room? All of that kind of stuff is cognitive decline. And it's telling you that your brain is not getting washed properly and that you have accumulation of waste there, and we need to clean that out and upregulate brain function. So we want to optimize glymphatics by getting good sleep, having good vascular health. Part of this is from exercise, not consuming very much alcohol, and keeping stress levels low. So things that you can do at home include be sure you experience darkness, because darkness is what turns on that norepinephrine, retinal hypothalamic pathway. That helps us to really get into a sleep state so that we can start washing our brains. Chinese medicine always says get in bed at 9, play, relax, read for an hour, and go to sleep by 10. This is the right pace and flow. This is the right rhythm for the brain to heal, the adrenals to heal. Every day we need to exercise. Shouldn't be a full-on, sweat it out workout necessarily, but we need to be moving several hours a day. Qigong is a fantastic way to work with lymphatic drainage in the body. And since everything out of the head has to drain into the shoulders, there's some great Qigong exercises to help open up the shoulder draining area. And then be sure you have your stress managed, that you're moving away from stress. because we need to be in that parasympathetic dominance. One of the fantastic ways to get into parasympathetic dominance very quickly is resisted breathing, and that's using a little pipe that makes it hard to breathe in and breathe out. The physiologic breath is 3 seconds in, 7 seconds out, 6 times a minute. The physiologic breath is 3 seconds in, 7 seconds out, 6 times a minute. So it's a very slow breath. The in breath stimulates sympathetics, the out breath stimulates parasympathetics. So you have over twice the parasympathetic stimulation as the sympathetic stimulation. And that puts you in correct ratio of sympathetic to parasympathetic. So this is a great way to get into parasympathetic dominance just with the breath. 3 seconds in, 7 seconds out, 6 times a minute. And then the other thing is to try to stay low inflammation with your diet. So eating mostly fruits and vegetables and clean fats, clean proteins, all those things help. All those things help. So the way that I do manual therapy for the glymphatics is first by opening the shoulder area, the main drains for the lymphatic system, which is the subclavian veins, and then working up into the brain. A lot of times the glymphatics aren't the primary problem. The primary problem is the vasculature. So I'll work with the vasculature first, optimizing flow in the arteries and veins of the head and neck, and then clearing away any congestion of the lymphatics in the neck. And then we're able to get into the glymphatics in the brain. So that's really like the end thing. We got to get everything else in place, and then the glymphatics will start to move. And this is really it really kind of as you're getting the other pieces in place, this is a really good way to jumpstart. The manual therapy is a great way to jumpstart glymphatic movement for you. And it's relaxing. It's nice. I hope you're better informed about your glymphatics and that you enjoy caring for them. This is Dr. Caroline Peterson.